Facelifting is one of the most popular beauty procedures ever, but what are the pros and cons, and who is qualified to do it? Hey guys, my name is Bahar and I'm excited about sharing my knowledge and personal experiences about skincare with you. If you haven't already, make sure to hit that subscribe button so you too can join our community. A facelift, as you guys know, is a cosmetic surgical procedure that helps to create a more youthful look in the face and neck. It helps with saggy skin, but unfortunately it does not help with wrinkles or fine lines created by sun exposure. During this procedure, a flap of skin on each side is pulled back, the tissue beneath is altered, and excess skin is removed. Normally, a neck lift is also done besides a facelift. This procedure is normally risk-free, and the normal side effects can be managed with the correct aftercare, and the long-term side effects are pretty rare. Side effects include 1. Hematoma, which is when blood collects underneath the skin, and it is normally seen 24 hours after the procedure, and it can be treated before it causes any major damage. Number 2, scarring, which is, well, expected. It is a surgical procedure after all, but it is normally hidden beneath the hairline or alongside with the natural contours of the face, and they rarely become risen scars, so there's nothing to be worried about actually. Number 3, nerve damage. This is one of the rare risks of this surgery, and it can be long-term or temporary. This can happen during the procedure, and it can end up in an uneven facial expression or appearance, which another surgery can help with this side effect, but it is, like I said, one of the rare side effects of this surgery. Number 4, hair loss. This is unfortunately one of the most common side effects of any surgery, and it can be temporary or long-term, and it normally happens near the incisions of your surgery. And lastly, any surgery has the risk of blood loss, infections, and even allergic reactions to the anesthesia. It is just something that is, well, for every single surgery, not just this one. Now, let's see who's qualified for this surgery and who is not. You need to have these conditions in order to do this procedure. Your cheeks need to have a saggy appearance, your lower jawline needs to have excess skin, you need to have very deep folds from the sides of your nose to the corners of your mouth, and you need to have excess skin and excess fat on your neck. Now, who is not qualified for this surgery or they need a little bit more care? First off, people who are taking blood thinning medication, because it is going to interfere with the ability of their blood to clot up, and it will increase the risk of hematomas. If you have a medical condition that prevents your blood from clotting up, you won't be able to have this procedure done. Or if you have poorly treated diabetes or even high blood pressure, you might face complications when it comes to your wounds healing, and you will have a higher risk of hematomas or even heart complications. Smokers might also have a difficult time doing this procedure because smoking does increase the risk of hematomas and poor wound healing. And if you are someone that is experiencing a lot of weight changes, this procedure might not be for you because, as you know, our weight changing does also affect our face, and you might not be satisfied with the end result over time. The internet is a great place to get information, but for beauty procedures, it is not enough. You need to have a sit down with a plastic surgeon that is very experienced in this type of procedure, and you need to ask them the risks and the benefits for your face, because every single person is different, everyone has their own different conditions, and you need to have a consultation before you book it. It is your face. You're going to see it for the rest of your life, so take it seriously. I hope this video was helpful. If you did, make sure to give it a thumbs up and click the notification bell so you can be notified every time I post a new video.